A patient comes in with sudden vision loss. Your scan shows a detachment, but which one? Retinal, choroidal, or vitreous? Pause, because that decision changes everything. Welcome. In this video, we'll learn how to differentiate retinal detachment from choroidal detachment using radiological imaging. First, a quick anatomy review. The retina is the inner neurosensory layer, firmly attached at the optic disc and ora serrata. The choroid lies external to the retina, separated by the potential suprachoroidal space. Retinal detachment occurs when the neurosensory retina separates from the retinal pigment epithelium. On ultrasound, it appears as a thin, echogenic, undulating membrane within the vitreous cavity. A key feature is its attachment to the optic disc, often forming a V-shaped configuration. On MRI, it appears as a thin linear structure, typically hypointense on T2, outlining the globe and tethered posteriorly. Choroidal detachment results from fluid accumulation in the suprachoroidal space, often due to hypotony, trauma, or inflammation. On ultrasound, it appears as a thicker, smooth, dome-shaped elevation. Importantly, it does not attach to the optic disc. On MRI, it shows smooth convex elevations, sometimes bilateral, and may demonstrate high T1 signal if hemorrhagic. To summarize, retinal detachment is thin, mobile, and attached to the optic disc. Choroidal detachment is thick, smooth, dome-shaped, and not attached to the disc. Recognizing these differences is essential for accurate diagnosis and appropriate management. Thanks for watching.
Bismillah ar-Rahman ar-Rahim. Let us first discuss the anatomy of the posterior compartment of the eye globe. If we look from internal, which represents the center of the eye, to the external, which represents the outer of the globe, the order is posterior vitreous number 1, retina number 2, and finally choroid number 3. The retina, choroid, and posterior vitreous layer constitute the posterior segment of the eye, arranged in a specialized layered structure to support vision, nutrient exchange, and structural integrity. From internal, which is the center of the eye, to the external, which is the back of the eye, the order is posterior vitreous layer, retina, then choroid. The vitreous humor is the gel occupying the bulk of the eye, with its outermost region called the vitreous cortex. Relationship to retina. The posterior vitreous cortex lies directly against the internal limiting membrane, ILM, of the retina. Adhesions. While not firmly attached everywhere, the vitreous is strongly adherent to the retina at the vitreous base, near the ora serrata, the optic disc, the macula, and over retinal vessels. Aging and PVD. With age, the vitreous gel liquefies and separates from the retina. Posterior vitreous detachment, PVD, which can cause traction on these adhesions points. The retina is a neuroepithelial responsible for light transduction. It consists of the inner neurosensory retina and the outer retinal pigment epithelium, RPE. The inner boundary, the ILM, which act as the boundary between the retina and the vitreous cortex, while the outer boundary, the RPE, acts as a barrier and anchoring point between the retina and the choroid. The inner retina is nourished by the retinal artery, while the outer retina, which is the photoreceptors, is avascular and depends on the underlying choroid. The choroid is a highly vascular, sponge-like tissue located between the retina and the sclera, providing 85% of the blood supply to the outer retina. Etiology of the retinal detachment. It results from detachment of the retina from the underlying choroid, caused by a tear in the retina, which is the most common cause, or tractional due to diabetic neuropathy, or exudative due to melanoma. While in case of choroidal detachment, detachment of the choroid from the underlying sclera, generally due to increased intraocular pressure resulting from subchoroidal accumulation of fluid or blood. Ora serrata cannot be seen on conventional imaging but is an inferred reference point. On the axial plane, it is located at 2 and 10 o'clock position of the globe. Red arrow. Immediately posterior to the ciliary bodies. Knowledge of this reference point may be useful to distinguish between retinal and choroidal detachment on imaging. Figure A and B is an example of retinal detachment with bilateral V-shaped intraorbital leaflets converging toward the optic disc. Importantly, the anterior margin of the leaflets do not extend beyond the ora serrata reference point at the 2 and 10 o'clock position. Conversely, figure C and D shows bilateral choroidal detachment with concave lens shaped and extending anteriorly to the ora serrata reference point. Radiological signs. In case of choroidal detachment, it spares the optic disc and end anterior to the ora serrata, giving the biconcave lens sign. While in case of retinal detachment, it arises from the optic disc and end posterior to the ora serrata, giving a V-shaped sign appearance. The posterior vitreous detachment occurs when there is separation between the inner surface of the retina and the posterior hyaloid membrane of the vitreous gel. The posterior hyaloid membrane is the thin laminar collagenous structure, part of the vitreous cortex, that lies directly on the surface of the retina. It is not technically a separate anatomical membrane, but rather the posterior surface of the vitreous gel. Regarding the location of the posterior hyaloid membrane, separates the posterior vitreous gel from the inner retinal surface. Regarding adhesions, the vitreous is most firmly attached at the vitreous base, followed by the optic disc, macula, and along the major retinal vessels. Retrohyaloid space, the potential and eventually real space that forms between the posterior hyaloid membrane and the retinal surface during the posterior vitreous detachment. Our final differential diagnosis regarding the retinal detachment, choroidal detachment, and posterior vitreous detachment. In case of retinal detachment, it gives the V-shaped sign and it appears as a thin mobile and related to the optic disc and end posterior to ora serrata. While in case of choroidal detachment, it gives biconcave lens sign and it appears as a thick immobile and not related to the optic disc. end anterior to the ora serrata by separation between the choroid and sclera. Finally, in case of posterior vitreous detachment, it gives a retrohyaloid space sign, which is linear echogenic membrane in the posterior compartment. Unlike retinal and choroidal detachment, the membrane will cross the intersection of the optic nerve sheath and posterior wall of the globe.